Okay, so we're gonna demonstrate some techniques for the psoas here. I have my wonderful volunteer here. Let's just make believe that we've done our assessment already. So I'm just gonna show you what I do. So we're gonna take a direct approach here. The main thing I want to drive home here is the fact that if you get your palpation precise, then there should not be much pain, all right? So I'm going to have my person bend her right knee here. I'm going to show on this side first because it'll probably be easier to see. We'll find out. Excuse me. Normally I'm checking, but we know each other very well. So I'm going to find the iliac crest here, and let me lower the table down a little bit so that I don't hurt my back in fixing hers. Okay, and can I bring this down a little bit more?
Yes.
Okay, thank you. All right, so I'm finding the iliac crest here, and a lot of people will just jam straight down on it, and that will be painful and uncomfortable. So what I'm going to do instead is I'm going to give a little bit of slack here, and I'm going to just really hug that iliac crest, and I'm using my top hand, so I've got like reinforced fingers like so, and I'm going to use my top hand to kind of swim underneath to kind of scoop the visceral tissue and the peritoneal wall a little bit out of the way, and then with the bottom hand I'm going to just kind of swim in alongside just until I encounter resistance. You don't have to go digging for gold here. I mean, this is, once you scoop the stuff out of the way, you should be more or less on it, all right? And then just to double check, I'm going to have my client or patient or whatever we want to call them, just very, very gently lift her foot off the table. Okay, and then relax, and that's it. And I feel the psoas pop right into my hand. And so from here, I'm just gonna have her so I'm gonna direct them thusly. So keeping your foot nice and heavy on the table without lifting at all, I want you to slowly slide it down until the leg is straight. You're lifting. You're lifting. Okay. Yeah, she's still lifting, but I'm not gonna hold that against her. Stretch out nice and long, and then relax. Relax. That's the hardest part for people. So you can give them a little cue sometimes by rocking. There we go, now we're good. How was that for you?
Good, the rocking helped.
Okay. Was that
Not
very painful?
at all. No.
Yeah. So that's all it should be. I mean, you don't have to go jamming on this thing. Once you swim back there, it's a very, very deep structure and you're on it directly. So the patient's doing all the work for you by extending the leg, all right? You're not doing your deep tissue, cross fiber, any of this stuff, because the motion will do the work of that for you, so just let it, all right? So I usually do 3 because, that I give myself 3 shots to get it right, and, All right, so once again, I'm coming in here and palpating now with my client here, because we have known each other for a very long time. I know her postural biases. She is an explosive athlete and so tends toward a lumbar hyperlordosis. You'll find that a lot with people like swimmers, gymnasts, combat sports athletes, boxers, wrestlers, those kind of folks, some types of dancers, break dancers in particular, as you may know, because the deeper lumbar curve allows them to generate a lot more spring, just like a bow in that way. So I know that I'm going to be thinking more about the medial psoas fibers that attach onto the lower lumbar segments, rather than somebody that's got this kind of situation where you're thinking more about the lateral portions of the psoas that are pulling at the thoracolumbar junction at T12L1, okay? So, and the way that changes the application is, so once again, when I'm swimming in here, I'm going to be directing my vector just a little bit more medial, okay, than I otherwise would. It's really, so, I don't know if you can see, so I'm more here for this than I am here, okay? So with somebody that you're looking to target the lateral fibers, you're really looking more in this area, okay? So I'll show it one more time, and then we'll balance out on the other side. Doing okay?
Mm-hmm.
All right. Nice and slow. Let's have you slide down again. Don't lift that foot. Don't worry about ripping my paper. It's going in the garbage afterwards. Stretch out nice and long through the heel and relax. So that was instructive what just happened, because the psoas here is fairly tight. So what you'll find sometimes is as the person does that final stretch, they'll kind of push you out. Don't fight that. Just ride it, just let it do its thing, let it push you out, all right? And you'll find that if you even keep a tiny bit of tension on the tissue, then after they extend, after they stretch out on that last phase, the slack will come back into the muscle. There will be a recoil response, and it'll sort of reset. So yeah. Can you see it on the other side? No, you cannot. So I'll just show what I do for the long hip flexor now. You doing okay?
Mm-hmm.
For rectus femoris. So yeah, and I can feel that she needs that as well. Now I'm going to be especially careful here because I know that this particular client is very sensitive in the legs, okay? So I'm going to find the rectus femoris attachment at the AIIS here. So we're right here. And I like to come in usually with an elbow because I find when I use my little fingies to do this, the very large and usually very strong rectus femoris muscle just laughs at me. So I'm going to come in like so. And I'm going to kind of hook the tissue here. So I'm starting supinated, and I'm rolling my forearm into pronation. You doing okay there?
Great.
And I'm going to feel just some tension build up along that attachment. And I'm just going to have you extend your leg through the heel, stretch your leg out nice and long, and then relax. Good. Yes, and now we've got some nice slack in that tissue. All right, and go ahead again. And then relax. Excellent. And a one more again. And relax. Wonderful. Okay. And you'll find after you do one or two of those, two or three of those, that the whole body of the rectus femoris will soften for you very quickly. All right? So hopefully that helps.